there's been several news stories and reports about how poorly in the United States we do with maternal care. So tell us more about how you're using the Meditech surveillance program to focus on that.
So we started working on those processes back about 10 years ago when Missouri had a hospital engagement network where we worked on protocols, order sets, but we never could get any lift off the ground to get it implemented every patient every time until we got surveillance. And even at that point, the nursing staff felt that it was going to be something that just took more away from them and didn't really comprehend the power that it could do for them. And so a couple of years ago, Joint Commission made it a requirement to
Hmm.
participate, and we got the green lights. Let's go ahead and build this. We started with something that we call a newborn high risk, and it's identifying moms whose babies may be at higher risk for experiencing low blood sugars. And so we built that profile, and very quickly, staff was very responsive. Previously, they wouldn't know whether they were supposed to monitor a patient for 12 hours or 24 hours. And immediately going live with surveillance, it was able to identify for them that this patient needed to be monitored for 12 or 24 hours. And so when Joint Commission made it a requirement for hospitals in the United States to address maternal issues of hemorrhage and high blood pressure, we were really able to move quickly because we had all the background completed. And what we did was we put the protocol right there with the alert. So when the nurse keys in that the blood pressure was 160 over 110, it'll send them an alert, and then they can select different actions for how they report it, what their next step is going to be for treating that patient. Having surveillance as part of the medical record, we can do everything from right there while we're at the bedside. Use it as a resource to find out what our next steps are. Our order sets has allowed us to pre-approve, if you will, a treatment plan. So a medication that you were going to want to consistently use for high blood pressure would be already on the medication administration record so that staff could just go to the record and get it ready. So when the patient comes in, we load that into their record as this is possibly something they may need. And so those types of things are initiated on arrival when the patient comes in.